Enugu State, a middle-aged man struggles to find comfort in his daily life, battling with constant need to urinate. The weak flow of urine and the embarrassment he encounters gradually becomes a norm. The 51-year-old father of two has been living with prostate enlargement for years, a typical scenario of what many men pass through in Nigeria and here in Enugu State. Prostate enlargement, also known as benign prostatic hyperplasia, BPH, is a common condition affecting millions of men worldwide. In Nigeria, it is estimated that more than 50% of men over 50 years old suffer from prostate enlargement. The prostate gland, a small walnut-sized gland situated in the male reproductive system, produces fluid that make up semen. As men grow older, the prostate gland enlarges, which can cause problems. Symptoms include frequent urinating, weak urine flow, straining to urinate, and urinary incontinence. Experts say that prostate enlargement may be a silent struggle, but not a solo fight. In today's edition, we are discussing this common issue affecting millions of men in Enugu State today. Good evening, viewers. I'm glad to have you in today's edition of our weekend show. I am Kelechi Ochiaga. The news of the day. Enugu State Governor Dr. Peter Mba has called on the United Nations Educational, Scientific and Cultural Organization, UNESCO, to identify and tap potentials of some sites with historical, cultural, and economically viable significance in the state. Chika Ugu reports that the governor was speaking during a courtesy visit by a delegation of the UNESCO at the Government House, Enugu. Her reports.
Enugu State is blessed with rich history and geological endowments. Presently, the state government has profiled over 170 tourism sites as part of efforts to attract over 6 million visitors annually and grow the state's economy. The governor highlighted Unsude Pyramid and Leja Iron Smelting Slab as some ancient technological heritage that should be recognized as World Heritage Sites. He also disclosed ongoing infrastructure upgrades at major tourism sites to transform them to international standard.
We do have a very deep history. We do have places where people would love to come, but I think it's identifying them and giving them the recognition that they deserve. So this for me is really a remarkable visit, and I think that it's something we want to take and run with. We'd like to work collaboratively with you and your team.
Earlier, the leader of the delegation from UNESCO, who acknowledged that Enugu State has geoheritage assets capable of driving geotourism, job creation, youth and women empowerment, as well as revenue generation, noted that the visit was the commencement of their partnership with the state.
Enugu State leads at this stage. It positions itself not only as Nigeria's pioneer geopark state, but as a continental reference for using geology to serve people, culture, jobs, and sustainable development.
Dr. Ishiaku further explained that sites that qualify for UNESCO designation must possess the geology of international significance with scientific, educational, and cultural values. He also expressed optimism that Enugu geoheritage sites will meet UNESCO standards and place the state on a global map for sustainable tourism development. In Enugu, Chika Ugu, NTA News.
The teaching profession remains the backbone of national development, shaping future leaders and driving socio-economic growth. Based on the foregoing, stakeholders are calling for urgent reforms to enhance the teaching profession. Chika Okore now reports.
Education remains a catalyst for human advancement, economic growth, and societal transformation. While the teaching profession in Nigeria continues to face several challenges such as inadequate remuneration, poor infrastructure, and limited professional development opportunities, stakeholders profile workable solutions.
Teaching profession should be made to be TRCN compliance. Another thing is the provision of better infrastructure, facilities, good laboratories, good libraries, well equipped. Supervision department should endeavor to monitor activities of the principals and teachers in schools to ensure that the students are being taught as they ought to.
Education analysts emphasize the need for states to borrow a leaf from Enugu state government by inculcating digital and experiential learning in their education sectors to enhance teaching and learning retention.
We are there about the smart green schools, which is building almost in every ward in the states. Very soon it will take off. It's really doing a lot. So I encourage other states to emulate what is going on in our states. Understand that this Simba is really doing the much it can to bring education, basic education, to the doorstep of every child in the states.
Contrary to this, an educationist, Mr. Ernest Joel, observed that most teachers are not prepared to do the work he described as a natural calling due to their inability to read and develop their skills.
In Nigeria, we are very, very low in reading. If you don't read, it will be difficult for you to deliver, because out of your content, that's what you're going to deliver. You're a teacher. Why are you depending on 30,000 naira money? I don't want to blame the government. There are too many things teachers can do.
As Nigeria continues to pursue sustainable growth, experts maintain that enhancing the teaching profession will improve the quality of education and contribute significantly to national development. In Enugu, Chika Okore, NTA News.
Let's now pause for some commercial breaks. Searchlight continues shortly. Don't go away.
National Productivity Order of Merit Award goes to the only tomato paste manufacturer to win the National Productivity Order of Merit Award by the Federal Government of Nigeria, endorsed by the Association of Private Medical Practitioners of Nigeria. This is an evidence of 100% natural goodness. Eat healthy to live longer. Buy now and enjoy up to 30% discount.
Introducing Naphtali's Hotel, 47 Ezilo Street, Independence Layout, Enugu. A moment at Naphtali's is an experience you will share forever. A luxurious suite fitted with brand new air conditioners, 42-inch plasma TV, free Wi-Fi, and basebook services, presented in a serene environment, distinguish us from the others. Our main bar, garden bar, and restaurant give you a wide choice of drinks and delicacies, while our 800 capacity fully air-conditioned hall is the ideal haven for that special event. Naphtali's Hotel swimming pool and gym are available all day, while our live band blesses your ears every Friday and Sunday. Enjoy a whole new world of top-notch hospitality in the cool city. Your security is our priority. We are Naphtali's Hotel, 47 Ezilo Street, Brown and Brown, Independence Layout, Enugu. For inquiry, call 0908-273-6086, 0908-273-6086.
And the National Productivity Order of Merit Award goes to the only tomato paste manufacturer to win the National Productivity Order of Merit Award by the Federal Government of Nigeria, endorsed by the Association of Private Medical Practitioners of Nigeria. This is an evidence of 100% natural goodness. Eat healthy to live longer. Buy now and enjoy up to 30% discount.
Are you frustrated with travel and logistics plan? Lovefish Travel and Tours Limited is here to serve you. We provide visa assistance, proof of funds, languages classes for easy international work placement, caregiver and social work certifications, both virtual and physical classes. Are you planning a work retreat or school excursion? Do you need to ship goods across the globe? We got your back with our premium cargo services at Akami Biam International Airport in partnership with Nigeria Export Promotion Council, Southeast Regional Office, and Ethiopian Airlines. In Lovefish Travel and Tour Limited, proficiency, efficiency, and professionalism is our watchword. Visit us at number 36 Umoji Street, Independence Layout, Enugu, or call 0706 295 8388. Lovefish Travel, moving dreams, moving you. Enjoy.
Glad to know you're still there. Now the background report. Experts have advocated regular checkup and prostate-specific antigen PSA test for males who are 40 years and above, as early detection is the key to the treatment of enlarged prostate, otherwise known as benign prostate hyperplasia. Eukaria Ugu in this special report takes a look at the awareness, cases, symptoms, and treatments of the enlarged prostate.
How aware are the adult male who have attained the age of 40 to go on a regular check to avoid the menace of enlarged prostate and the twin brother prostate cancer?
Yes, I've gone for the test on 2 occasions because it's not a funny thing at all. I've seen a lot of men who are suffering from this, and it's not something that gladdens the heart.
Prostate is a gland in the male reproductive system which stores fluid that aids sperm during ejaculation. As a result of its location under the bladder, the muscles control the flow of urine. However, aging makes the gland to grow bigger, thereby constricting the mouth of the prostate, which makes urination difficult. Dr. Kechukwu Obodo is the consultant public health physician.
Technically, we classify them into 2. The large one that is benign, the one that is not cancerous. There's another type that is so cancerous. But they are called the predisposing factor is male when they are getting old, from 40 years and above. That particular prostate tends to enlarge. Sometimes the patient becomes because of the backflow of the urine, when they are not excreting all of them out, then it can affect your kidney. So it has a lot of complications. The cancerous ones, of course, is more dangerous than the one that is benign. If factor first is age, there's no particular predisposition. It occurs more in blacks. It's not hereditary. It doesn't even run in the family. It's not like diabetes or hypertension.
On the symptoms, experts enumerated frequent urination, weak urine flow, difficult in starting and ending urination, as well as drowsiness.
It's an issue you see in men that are, elderly men. These days, you see it in middle-aged men. Enlarged prostate can also be due to cancer of the prostate, what we call CAP. So these are common things that can cause the prostate to be enlarged. So, but the most important thing is that whenever something like that happens, or whatever you hear, you have problems of prostate, like symptoms, like difficulty in passing urine too frequently and all that, and you go and do a scan and tell you the prostate is enlarged, you need a specialist to assess you.
On the treatment, experts have advised patients to see a urologist who will diagnose and offer appropriate treatment.
You have to come so that we evaluate you. They will clerk you, do general examination, then you do some tests. Then we now classify it whether it's the benign type, that's the one that is not cancerous and also cancerous. So if it's cancerous, then we use drugs we use to treat cancer cells, because to remove it will spread more.
The treatment is still surgery. Of course, there's medical treatment, there's surgical treatment. If you want to cut out testosterone supply to the tumor, that's the cancer, you need to stop the body from releasing testosterone to the prostate, and that is a surgical procedure. That surgical procedure will, because those testes are the major supply of testosterone. So is a surgical procedure to prevent the testes from releasing testosterone to the cancer. If you get it in the advanced stages, when he has destroyed some tissues, he has even destroyed the prostate, or is even preventing the person from passing urine, or the person having blood in urine, it's still a surgical procedure.
Experts advise male adults who are 40 years and above to go on regular checks to avoid the life-threatening conditions of enlarged prostate and cancer. In Enugu, Ukeria Ogu, NTA News.
Thank you, Kera, for that background report. Joining us in this sensitive health discussion is a renowned urologist, Dr. Solomon Anyimba. Glad to have you in our studio, Doc. You're welcome.
Thank you for having me.
All right. Let's start from the basis. In a layman's understanding, what is a prostate enlargement in men?
All right. As a preamble, I want to state that prostate is an organ in men situated just beneath the urinary bladder. As men advance in age, prostate will start enlarging. We have similar things in females. When they get puberty, the breast start enlarging. So prostate will virtually enlarge as men advance in age. So in layman's term, prostate enlargement means enlargement of the prostate beyond the normal size. Normal size of the prostate is 15 to 25 grams. But as men advance in age, the prostate can enlarge up to 300 grams or even 400 grams.
All right, thank you very much. What could you say are the symptoms? What one will see and know that he's about having a prostate enlargement, or rather he's having prostate enlargement?
There are several symptoms. One, frequent urination. Person notice that it goes to pass urine frequently, maybe up to 2 times within 1 hour.
Okay.
And may also be frequent urination at night. Person wakes up several times at night, maybe up to 4 or 5 times at night to pass urine.
Okay.
And what we call urgency, the person will not be able to postpone urination. So if the person doesn't go to pass urine, as if the urine will come out on its own. And sometimes urine will also come out, we call it urinary urgency. Other symptoms include weak stream. Urine stream will be very weak. The person also may strain to pass urine. The person may have what we call intermittency. When the person is passing urine, the stream may break, start again.
Okay.
There may also be feeling of complete emptying of the bladder. So after passing urine, the person feels that there's still urine remaining in the bladder. So these are the common symptoms.
Okay. Our viewers would like to know what age range are at risk of this issue.
Usually from 40 years and above.
40 years and above.
Yes.
So one below 40 years cannot have it?
Yeah, person will not likely have prostate enlargement, but there may be other conditions that may affect the prostate in people with less than 40 years. And that's mainly prostatitis, infection of the prostate. That's common in young people below 40 years.
Okay, how is it diagnosed? Are there treatment options?
Yes, diagnosis can be clinical by asking the person questions. The person will give these signs and symptoms. They also want to examine the person. That's what they call this direct examination. The urologist will put the finger in the anus to check the prostate. So the person will feel normal, no obvious, no feature of cancer from the examination, and
okay.
Also the urologist will feel that the prostate is enlarged by that examination. So from asking questions and then examination, you may have an idea of what's happening. Then ultrasound will also be done. The scan will show that prostate is enlarged. Remember, the normal size is 15 to 25 grams. The ultrasound will demonstrate that prostate is enlarged. It will usually give out the dimension of the prostate gland. It's also important to do what we call prostate specific antigen, PSA. Usually to be within normal. Normal range is 0 to 4. In prostate enlargement may be within normal, unlike in prostate cancer when it will be elevated. So treatment option.
Yes, treatment options.
Yeah. Medical and surgical. Medical will include the use of drug that will relax the bladder neck to allow the urine to flow out. Another option is to give drug that can shrink the prostate. That will help to relieve the pressure in the urethra. This medical therapy treatment is for people that have mild to moderate symptoms. People that have severe symptoms, it's good to have surgical treatment. There are 2 modalities. One is open surgery, which we have to cut the person open to remove the part of the prostate that's blocking urine. Secondly, is what we call endoscopic surgery. That one, no need to cut the person up. We use a special machine to remove the middle part of the prostate that blocks urine. Remember, the surgical treatment in this patient doesn't involve the whole prostate. It's just the middle part of the prostate, the part that's blocking urine that is removed.
Okay.
The other part is still there. So the person will still need to be going for checkup for prostate, especially with PSA because of cancer.
All right. In checkmating this prostate enlargement, is there natural remedies? Is it obtainable?
prostate
using
cancer.
to prevent or to cure? Yes.
Yes, prostate cancer is good to do yearly PSA before.
I mean natural remedies. Okay.
Okay. Natural remedies. No, that PSA is very important because you need to detect it early for cure. To the best of my knowledge, at the moment, there's no natural remedy to prevent prostate cancer. So it's good to detect it early. That's why we advocate for yearly PSA. So when it's detected early, it can be managed.
All right, Doc. Okay. Well, our viewers would like to know also whether prostate enlargements could it be cancerous?
Prostate cancer is different from prostate enlargement. These are two different entities.
Okay.
As men advance in age, the prostate will enlarge. It can enlarge and will not be cancerous. It can also enlarge and become cancerous.
All right.
Some other prostate may be within normal and be cancerous. So the enlargement doesn't lead to cancer.
What's the risk there if it's cancerous?
The risk? Once prostate cancer is common in blacks, so one of the risk factors is that if in our environment we are blacks, so it's quite common in blacks, also common in people that are advanced in age. Family history is also another risk factor. So once someone has a family history of prostate cancer, and the person needs to start checking his PSA, prostate specific antigen, early enough.
Can this ailment affect a man's sex life in any way?
Yes, prostate enlargement may be associated with infection of the prostate, and if there's infection of the prostate, it may affect the erection. Prostatitis, that's infection of the prostate, can affect the erection. Also, some of our patients come very late, and when they come, they can't pass it at all, so we need to pass a catheter. Catheter is a pipe that we put through the penis, through the urethra, to drain urine. So if a man is on catheter, he will not be able to have sexual intercourse. So that's the need for early presentation to the hospital.
Could you please tell us, Doc, the lifestyle that could help the sufferer of these prostate enlargements, or let me say prostate cancer?
All right, for prostate enlargement, exercise is very important, and then take a lot of fruits and vegetables. So for someone that doesn't have prostate enlargement, it's good to also have some lifestyle modification. So men that are advanced in age are encouraged to avoid intake of processed food. Go more for fruits and vegetables. And so for prostate cancer, there's no lifestyle modification that will help to prevent that. It's treatment. Once you detect it early, treatment. So the emphasis for prostate cancer is early detection. But prostate enlargement, lifestyle modification, fruits and vegetables, exercise also helps very well. So it's good for men to exercise. If the person is obese, it's good to lose weight because obesity may also worsen the prostate symptoms.
What other steps are you advising men to use to really reduce that risk? Any other, apart from exercise and dieting?
Yes, these are the most important one: exercise, diet, then avoid processed food. These are very important steps that one needs to. Okay,
what message do you have for the men in Enugu to really know how to prevent entirely and be up and doing about prostate health?
The men in Enugu should know that prostate enlargement is quite common in men up to 40 years and above, and symptoms may manifest. Also, prostate cancer is also common these days in our environment because of maybe changes in weather and then our lifestyle.
Okay.
So it's good for us to go back to the roots. These days, men or people go to shopping malls and buy packaged food without taking cooked food in the house. So we encourage men to go for natural food, take fruits and vegetables a lot, reduce intake of processed food. Then whenever you have symptoms, you need to see a urologist. Whenever you have urinary symptoms, it's very important to see a urologist to examine you. Prostate cancer commonly spreads to bone. So we encourage men that have bone pain not to attribute it to arthritis. You need to see a urologist first. And then prostate antigen should be checked, because if there's prostate cancer, it may spread to bone, and person may have bone pain, and you may think it's arthritis, but not arthritis.
All right. Thank you, Dr. Yimba, for your valuable insights. Prostate is a vital part in men's health. Let's break the stigma. Thanks for watching. We hope to see you next weekend. Good night. Bye.